Good morning, friends, and welcome to this amazing Pamper Yourself series. As all of you know, Pamper Yourself series just got initiated on Jan 16th, 2021. That was during our 25th, series of the Get and Get Fit series. And the whole idea was if you want to really pamper yourself and make yourself feel nice at every given aspect of your life, I think self-love is the best love you can have for yourself. So that was the intention, and we have had a few speakers before on the Pamper Yourself series itself. And today we're going to have Dr. Seema Mathew. And before I introduce her onto this platform, I want you all to understand that all of us are built for a particular purpose in life. And the essence of our life is to, do good to others, do good to the best of our knowledge to others, right? So with those few words, I would like to introduce Seema. Seema has been known to me for over 10 years right now. We are good buddies. I know she's much my junior, but still, we share a very special bond with each other. And today's topic is going to be transforming faces with non-surgical techniques. So all of us want to look good and feel good and look young. But what are the other ways of, taking yourself to that level of making yourself feeling young? So here are a few qualifications why Seema is on this platform today. So she's completed her MDS, MOMS, RCPSG from UK, FIDI, and Diploma in Medical Cosmetology. She's a graduate from Christian Medical College, Ludhiana in 2005, where she completed her bachelor's of dental surgery and went on to do her master's in maxillofacial surgery from Savita Dental College. She's been a top ranker in the MDS, curriculum all the 3 years, and also has the highest score in 2010. And she's also the member of the Royal College of Physicians and Surgeon, Glasgow, UK. She's got also a fellowship in implantology in 2012. She's got a PG diploma in medical cosmetology. She was working at Raga's Dental College and Hospital, which is also my alma mater. And she's a practicing consultant in various centers and has multiple publications and awards from national and international state conferences to her credit. She also owns her own dental clinic under her own name brand, and she's the most sought for speaker on this particular topic, which we're going to discuss today, called facial aesthetics. So with no further ado, I want to call Seema onto the stage. So Seema, the podium is all yours. I'm getting your presentation done there. So in that meantime, you can just, go ahead, unmute yourself and you can start.
Hi, good morning, everybody. And thank you, Vidyaa ma'am, for the invitation to, talk at this platform. It's always a pleasure. I love to, share what I do and the knowledge that I have gained and the journey that I've had. So I basically started like a dentist, but, then I specialized into surgeries of the face. So basically the surgeries of the face will be if somebody has an accident or somebody has some deformity with which they have born with. So you correct their face and make them look normal so that they have a normal life. So that is how it is. So, when you give people the joy of having a normal life, you feel good about it. And when you look good, you also feel confident about it. So that is one of the reasons, along with surgical techniques or doing surgeries on the face, I sorted after doing non-surgical techniques. Why? Because everybody does not want to go under the knife to become beautiful. There are other ways to look beautiful. There are other ways to look young. There is no crime in looking beautiful. Some people say we should age gracefully. I said, yes, you should age gracefully, but you should also maintain what you have. If you have a car, you service it so that it runs smooth. You eat food so that you stay healthy. The same way when you take care of your face, your body, your skin, your hair, you look good. It actually impacts onto your life by showing a positive attitude that you really love yourself. When people see that you love yourself, it actually attracts them to come to you, and you will be able to spread good things around also. And people are always watching you. And you will also be a source of inspiration to others when you really love yourself and when you are a happy person. So that not only includes taking care of your face by applying cosmetics, but it also improves, like, you change your lifestyle where you have workout, good eating habits. All these things are a part of pampering yourself and taking care of yourself. And it is very, very important that you do these things. Now, to tell you about the non-surgical thing is, first I have to tell you what aging is. So as we grow older, as we cross the age of 30, what happens is that there is some amount of aging that sets into our body. So the first signs that you see when you start having a lot of stress and you're managing your house, your work, your kids, your family, everything is being multitasked. You look tired, you are sleep deprived. So one of the things that you usually see is the under eye darkness that you see. So your under eye sort of becomes very hollow. One of the reasons is because we have fat pads over here. When the fat goes off, this looks hollow and the skin looks shriveled and it looks dark. So if the pigmentation is there, there are treatments to, sort of add the volume that is lost. So these are done by materials called as fillers. Filler is nothing but hyaluronic acid. So you can put those and it's completely safe. Hyaluronic acid is something that's there in your own body. It can be replaced in the under eye region. It can be replaced in the chin region, in the cheek region. So it can be, when you lose volume here, you can add it to add volume because we look drawn and gone. Okay. So one of the main signs I told you is the under eye darkness, and then you feel everything starting to sag. That means you start having jowls, you start having these nasolabial folds and lines. You start having wrinkles because of tension. So see, it's not that you have to look plastic. Doing these things don't make you look cool. Overdoing these things make you look plastic. So you should not get obsessed, but you should know the fine balance of doing it so that you look pleasant and pleasing. So even when you go to your workplace, you look nice. I mean, you don't always have to wear a lot of makeup. You can always look nice. The second thing is our skin starts having pigmentations or marks, or you have marks because of acne. You have marks because of pigmentation or hormonal changes. So all these pigmentations can be treated by using certain creams or certain acids. These are called as fruit acids. So when these peels are used on your skin, it helps in exfoliating your dead and damaged and pigmented skin. And then you have the fresh new skin. So what happens with age? There is no cell turnover. That means the cells are being formed, the cells also shed when you're young. But the amount of shedding becomes less as you become older. So the number of, the layer of the skin becomes thicker and the texture is not smooth. So it needs to shed. To allow it to shed, we apply certain chemical peeling agents that helps your skin to shed. So when the old skin sheds, it gives you a new supple appearance. So it makes the skin look smooth. So that is called as a chemical. So that is another way of removing textural irregularities on your skin, pigmentations, marks. Now, when you have acne, there are peels to take care of the acne to control the oil secretion that is there in your skin. So that is all peels that are done. So again, now I told you, when your volume is lost under your eye or in your cheek region, or when everything starts sagging, you have to replace the volume. Okay. Also, when our face starts sagging, it's because the collagen in our skin is depleted. The collagen is the ground substance of our skin. So when it gets depleted, the skin becomes loose. So there are techniques to improve the collagen. So the best way is to use threads. That means micro injuries are created in the skin so that the skin starts healing and repairing, and it forms new collagen and the skin becomes tight. So instead of doing a surgical facelift where you lift the face and make it look tight, there are non-surgical ways where you can use threads, something called as facelift threads, which is done by the chair side when you come to meet your doctor in just 5 minutes. It's completely safe, no complications. You can get a non-surgical facelift and go back to your work and do your normal work. Nobody will even know that you've got something done. So these are ways, if you inculcate and incorporate into your routine, daily care and pampering yourself, along with the beauty parlor treatments that you do and the spas that you do, it sort of will help you maintain your face and your skin and your hair. Again, another thing is, from our blood, we take something called as your platelet-rich plasma. So the blood is taken, a little bit of your 5 ml of your blood is taken. It is centrifuged, it is processed. From that, you take the platelet-rich plasma, which is called as PRP. Now, when the PRP is applied to the face or it's applied to the hair or infused to the hair, they have a lot of growth factors. So they help in anti-aging. Okay, so they stimulate the collagen and they help in anti-aging. When it's used for the hair, it helps in hair regrowth. The hair starts becoming thin and we start losing our volume and we start balding. So when you incorporate these techniques of treating your hair prior to, before it gets completely damaged, it does a lot of good. So it is very important that you start these things way before, things are really bad or when it gets really this thing. So this is one of my patients' picture that I would like to show. I met her 3 years back. She started coming to me, and the transformation you can see from looking where you can see the under eye region, you can see the cheek, the chin, the lip. She looks even more prettier. I have a better picture of hers looking now, and she's so grateful because you help women and men to bounce back into life and to feel good and confident about themselves. The next picture. This is again, see, it is not only women that do these things, even men sort out, it is important that you look good and you are presentable, and maybe you want to look good to, go to your son's school, and you want the other parents and other kids to feel that you are looking young. So it is very important that you groom yourself and learn to love yourself. It is very, very important. Loving yourself is never a crime. So when you take care of yourself, you look good. Okay. And it is important that you do that on a regular basis. Next. Again, sometimes we put on a lot of weight and our face looks more chubbier and we want a more contoured kind of face. So then we can do these techniques also to reduce the fat in the cheek region. That's called as a reduction of the buccal fat pad. And then I told you we can use machines and threads to, contour the face. So there is a lot of non-surgical ways in which you can correct the double chin, the fat that is there in your cheeks. You can contour your face to look more slimmer and nice. So what happens nowadays is everybody is into fitness, losing weight. So once you lose weight, everything starts becoming sagging because all the fat and volume is gone. So when you lose volume, you have to add volume so that your body will look thin, but your face should look not drawn or gone. So you add something called as fillers, which is hyaluronic acid. Suppose if you're on the other spectrum where you're more chubbier and you have a lot of fat in your face and your double chin area, targeted areas of fat can be removed non-surgically by injecting fat lipolyzing injections. There is no side effects to it. It only dissolves the fat in those regions. So it can be done for the face, it can be done for the arms, it can be done for the tummy, it can be done for your bra folds, your love handles, in any place, in your thighs. So it's only a localized removal of fat without doing surgery. So this is one of the techniques that is there. The next picture. Next picture. Yeah. See, this is a lip. So sometimes what happens is that aesthetics of the face, lip is also very important. Sometimes we might have a very thin upper lip. So the minute you smile, you might not be showing much of your lip. So this can be augmented by adding filler or volume to the upper lip. It is just done in 10 minutes on a chair side. You come, get it done. And it usually lasts for 1 year, 8 months to 1 year. It's not a permanent thing. It's a temporary one, but it definitely adds volume to your lip. So this is one way of enhancing your lip aesthetics or the look of your lip, because with age and time, your lip tends to get wrinkled, it becomes thinner, and there are fine lines and wrinkles that are seen. So this is a very excellent way of getting it done. It looks natural. You see a lot of pictures on internet and social media where they have that big pout and all. You don't need to overdo it. You just have to do it in such a way that your face looks balanced. Next picture. again, teeth is very important. Smile is very, very important. Vidya ma'am will agree with me because, that's one of the things that everybody sees when they notice you. So if you have protruding teeth or yellow teeth or you have missing teeth, it sort of affects your confidence level. So there's something called as smile designing that we do where we contour or, align the teeth. It is not done only by braces. We can do something called as veneers or full ceramic crowns in which you can push the teeth behind, close the gaps, replace the teeth, and sort of give them a very aesthetic, pleasing smile. Because once the teeth are aligned, it makes you also look younger and nice and vibrant and confident. So this is another way of improving the non-surgical way of improving the aesthetics of your face. So the face is not only the eyes, it is also your skin, it is also your hair, it is also your lips, your teeth. It's the proportions that you create for having a very balanced and a pleasing and a youthful look. Next picture. Again, I told you hair issue is an issue for both men and women, where you start seeing that the hairline starts getting receded, the hair becomes thin and fine, and there's a lot of hair loss. So the minute you comb, you see a lot of hair and you get scared. So it can be because of different reasons. It can be because of nutrition. If you're on a lot of long-term fasting and you're not taking nutrients enough, then you can have a lot of hair loss. Second is if you have a genetic predilection, that means somebody in your family already has hair loss or balding, then you have a high chance of getting hair loss. Third thing is if it is hormonal. Again, male pattern baldness is there, female pattern baldness is there. It's because of the hormonal issues that you lose hair. So if you early detect all these things, you can treat it so that you don't lose hair later on in life. It shouldn't be that you bald and then you go and treat it. That hair transplant is the only option, or wearing a wig is the only option. But if you start early when you see signs of hair loss, then the best is that you can get back your hair. So this is one of my clients who got back his hair in just 3 months time, like just 4 or 5 sittings in which he started noticing the regrowth of his hair and the volume and the texture became much, much better. So this was done by using your own plasma. His own blood was taken, the plasma with the growth factors was taken, and it was infused onto his scalp, and this helped in growing the hair back. So it is a non-surgical, completely safe 20-minute procedure in your dental chair side, which is repeated every 2 weeks once, and it gives amazing results. So you need to know what the problem is and address it much, much earlier in life to get the best results. Next picture. Is there anything?
That's it, dear.
Yeah, so these are the topics that I wanted to cover and say there is no crime in doing these procedures. You can do it if you really love yourself. So I think I would encourage every person to, start loving yourself and learn to groom yourself. You might say, I might go to a parlor and do facials. Is that enough? The thing is that when you go to a parlor and do facials, it's very superficial. The creams are being infused only to the top layer of your skin. There is no exfoliation that is happening, not much. But if you do a chemical piece, where you help in exfoliating the dead and the damaged or the pigmented skin, and then sort of infuse the products and creams onto it, the absorption is better, the results are better. So it is very important that you use science along with your daily life so that you improve the quality of your life. Then again is when you have pigmentation, there are lasers that are available that helps in removing these pigmentations. So the lasers basically will target only the black pigments that are there. So when you use a laser toning, it helps in evening your tone. I will tell you my story. I was one person who had a lot of acne. I had a lot of marks. So, when you do a lot of procedures, there's a lot of splatter that happens on the face. So every time after the procedure, I had to go and wash my face because I didn't want acne, because I used to really struggle with it. And there are times when my patients have come and asked, doctor, you have so many pigmentation, you have a lot of marks. So it was a constant struggle to treat it. It takes time to treat pigmentations and marks, but if you consistently do it, you can get the skin. Today, I'm not even wearing any makeup on my face other than my lipstick and my eyeliner. So see, if you want to walk around in your daily normal routine life looking good, then it's very important that you take care of yourself. So loving yourself is the best gift that you can give to yourself. And I would encourage every person to do that. Lockdown, I went into fitness, lost 10 pounds, it all shows that you love yourself when you take care of your body, your face, your skin, your hair, and everything, even yourself. So you will learn to take care of people around you. Thank you so much for this opportunity. Thank you for listening to me patiently. I hope it was useful for all of you.
Thank you so much, Seema, for really, pouring your heart out and giving us a kind of understanding of what we need to know. I think, there are many doctors on this forum, so they might have some questions. So I would encourage all of you to post it on your chat box so that, we'll be able to take them one by one. But nevertheless, a few questions from my side, Seema. So many a times we see these people, having a facelift or, the sagging skin getting tucked up and the body fat getting sucked out. How would you evaluate this over a long period of time?
I feel nothing should be overdone. Okay, there should be a balance of, you should do it only if it is required. So it is very important that you go to the right kind of practitioner who does it on a regular basis. See, one concept that I have seen is sometimes people only fill. So they become dysmorphic by filling too much. It is also important that you tighten the face and also fill where it is required. So, a person should not lose that balance of how much to fill. Just because a patient comes and asks, I want it filled here, need not be that you should do. There are other ways of doing it. You will have to sit with them and counsel them, because you're not only addressing the person as a person or a patient, you're also addressing the psychological part of them also, as to why they're doing what they're doing, whether they should do it or not. So it's a journey that you will go through with your patient to make them understand whether it is required or not. And as a practitioner, you should only do what is required for the patient. For the commercial reasons, it shouldn't be that, you ask your patient to do certain procedures. And also, I would advise every patient or every practitioner to practitioner to be scientifically, knowledgeable as to what to do, and not only practice one technique. It is important as a practitioner, you should evolve in the techniques and the various technologies that are available. There are a lot of advancements that are available. So you have to learn to do a combination treatment for your patient rather than sticking only to one treatment. Then only your patients will get the best result. And for patients, the advice I would give is, if a particular treatment is suggested to you, go learn, read about it, know what you're getting into it, ask your practitioner whether it is good, is there something else that is available or not, and then go and get yourself done. Because I have had patients who have gone and got surgeries done, then they've screwed up the whole thing, and then they come to you for correction. So it is very important, because it affects them psychologically, because they become really depressed also. So it is very, very important that you're not only treating the face or the physical body, you're also treating them mentally, emotionally, psychologically, to thrive and to do well. So it is very important that you do the best kind of treatment and only what is required. So a lot of time has to be spent on counseling the patient, and pre and post photographs are very, very important to, authenticate what you're doing and, to show them the results. So, and documenting it is very, very important, according to me. Don't go overdoing anything.
Thank you so much.
Don't abuse.
One more thing which I loved what you said was tighten it up and then you go about doing the filling. And we have another question from Dr. Sendil also saying for the, jawline. He said, like, how about using some silicone blocks? So how about that?
See, jawline, you have to evaluate whether if it's a male or a female. In a male patient, you want a broader jawline, where you want a broader defined chin and you want a broader defined angle of the mandible. Now, you can augment it by doing either a genioplasty surgically or putting implants on your angle. The non-surgical technique would be to use fillers. Fillers can be augmented on the chin, the jawline region, and on the angle to give a chiseled look for a male. Now, when it comes to a female, you don't want to masculinize their face and make the chin look more broad, because that will make them look very dominant in their character or very malish. So you want them to look more feminine. So for that, you would give them only a chin which is only projection here, not projection here where you will make them look wide. And you will not augment here. For them, in the female, you will do a BOTOX for the angle of the mandible into the masseter to make the face look more thinner. So you want the muscles to look thinner, the face to look thinner. So for that, you will do BOTOX for the angle, and you will add filler here and a little filler here. And if you want, you can do threads to tighten the jawline so that you get a defined jawline. Because what happens is the neck and the throat angle can become together. So it is very important that you define the chin, the skin in the jawline region. So there are machines with which you can tighten the skin also to get a defined jawline. Suppose if you have submental fat, then you will have to address the submental fat by using lipolytic injection so that the fat is gone, and then you tighten the skin by using threads. You can use BOTOX for contouring the jaw, the masseter muscle, and add fillers to sort of contour it. Nothing that you do on your face should be permanent because your face tends to change. So it is always important that you do according to the changes on the face, because the face will never stay the same. There will be age-related changes there. So according to the age-related changes, your treatment plan also should modify. Now, there was a question on wrinkles. What should we do? I did not touch that topic. BOTOX is something that is used for addressing wrinkles, especially wrinkles on the forehead. Then there are wrinkles on the crow's feet region. There is also the bunny line wrinkles. There's also wrinkles in the mentalis region over here and the corner of the mouth. So all this is addressed by doing BOTOX. So usually I prefer to use BOTOX for the upper face so that, you know, your skin is tightened and you don't have the fine lines and wrinkles. Again, the use of BOTOX is, it also helps in lifting the eyebrows. So sometimes the eyebrow tends to droop down. So when you do BOTOX to the corner of the eyelid, the eyebrow, it helps in lifting the sagging eyebrow. And you also have the fine lines on your crow's feet region. That means when you smile, you have these 3 lines that is there. So that also, the concept of BOTOX is basically it helps in relaxing the muscle. So the muscle movement doesn't happen. So what happens with age and time, the skin becomes loose and sagging. So when the muscle moves or there is expression, the muscle moves. So the skin on top of it will show the lines or the wrinkles because the skin is loose. So, but when you inject BOTOX into the muscle, it helps the muscles to relax. So the muscles do not move too much. So the skin on top of it also doesn't move. And that is why the lines and wrinkles don't show. Now, BOTOX effect usually lasts for maximum 4 to 5 months. It is not a permanent thing. You have to keep doing it. Now, if BOTOX is done in the wrong way and it is put in the wrong muscle, then you can have paralysis of the wrong muscle. So it is very important that you put it in the right muscle. So if you want to remove the lines and wrinkles in the forehead region, then BOTOX is put in the forehead region. But you also have to make sure that when you put, you don't lift the eyebrows too much. So the balance has to be done because muscles tend to pull in opposite direction. So you also balance it by doing it in the opposite muscles so that, you know, it doesn't lift and give you that witch kind of look on your eyebrow region. Suppose if you're doing an eyebrow lift, you have to balance the amount of BOTOX that you do. You also have to lift the muscles in this region because your the muscles in the center over here helps in pulling the eyebrows down. So if you only BOTOX this part, it will only lift and it will look like a witch. So you also have to balance the muscles in the center or the glabellar region so that the eyebrows have the best aesthetics. Now, when you have lines and wrinkles here, you can give baby BOTOX in the under eye region also. Again, I talked to you about BOTOX for the masseter to thin the masseter muscle or thin the face. Again, the corner of the mouth can droop down and you can have a sad kind of face where your lip corners tends to droop down. That is because of the pull of the depressor anguli muscle, which tends to pull the lip down. So when you give BOTOX to the corner of the mouth on both the sides, it usually lifts the corner of the mouth and you have a happy face instead of a sad face. Again, when you do this, you have wrinkling that is there on the chin region. So that also can be removed by doing BOTOX in the mentalis muscle region. So all these procedures that you do last for 5 to 6 months. It helps the face in not looking plastic. It helps in making the face look more relaxed. That's it.
Awesome, awesome. So I'm getting a lot of good feedbacks coming. They're saying very informative session. And so thank you so much, Seema. I mean, any other questions? We can take it. We have another few minutes. But otherwise, I guess it was very crisp. It was very clear and very informative to help us all understand, because there is a kind of a fear that this would make the face plastic and it would need recurrent treatments. And sometimes we have seen actresses whose face or certain parts of their face, totally deformed, if I could say. And that cute looking face which was there before is not there anymore. So any comments on that?
Yeah, there was one question that somebody asked, can Botox be used for muscle pain? Yes, it can be used, especially when you have these headaches, especially in the temporal region, you have these headaches, the neck pain, the shoulder pain. Yes, Botox can be used to relax the muscle and to ease the pain, along with short waves that you can give. So it's a treatment usually for a particular problem is not one shot or one bullet that you give. It is usually multiple things which is given in a combination that gives your patient the best result. Now, you talked about actresses, getting deformed. Why? Because there is no fine line of how much they do. And there is also a thing where people do a mistake of going from one person to the other and doing it in multiple places. Too many cooks spoil the broth also. And, sometimes looking at your face again and again in the mirror, it sort of becomes, you start becoming obsessed also. So you need to know where that obsession lies, whether this part is going down or not. You might be perfectly looking fine, but to your eyes, you might feel there is something abnormal. So it is very important that you have good friends and good practitioners who will tell you what is required and when something is not required. So we all need validation as humans, We want everybody to validate that we're looking good. And, that validation should come from inside of feeling good. If something is required, only you should address it. And never overdo any surgical or non-surgical procedure. Do it only if it is required, only to keep your fine balance and make you look good and, make you feel healthy and happy. Main motto is being happy is the most important thing. Can Botox be used for TMJ pain? Yes, I use Botox along with the splint and the arthrosynthesis I do. I also give Botox for the masseter muscle and the temporalis also, because they usually have myofascial pain associated with it. Yes, I do give Botox.
And somebody else has also asked, like, are they carcinogen as you put them on your skin?
No,
I guess
they're not carcinogen.
Okay.
They're not carcinogenic. Not at all.
Yeah, go ahead.
Because the products that you use is basically, whatever you use, you need to use sun protection. You're not going to get skin cancer or anything. Only thing, the products that you use is hyaluronic acid. Hyaluronic acid is basically there in your own skin and in your own body. We're only replacing what is lost. So we are not adding anything artificial or new. Yes, they are available in vials in processed forms, so that is used. Usually, the amount of allergy or complications is very less unless you put a filler directly into a blood vessel and you occlude the blood vessel and that part becomes necrose. That is why whenever you put a filler, the technique is very, very important. The place that you put is very, very important. Your knowledge of the anatomy is very, very important. And whenever you put a filler, you always have to aspirate and then only inject. You don't shove the needle in and inject. You always aspirate, wait, see that you are in the right plane. You're not into a blood vessel and then you inject. So the knowledge of anatomy is very, very important. Skill is very, very important. You can't just take a syringe and just start injecting anywhere and everywhere. So knowledge, skill, experience, all these things matters for you to become, and, to combine different treatments. See, everybody's face is different. You can't have one treatment for everybody. So you have to combine it and change it and customize it according to your patients and give them the best results and make them happy.
Thank you so much, Seema. And as always, it's a pleasure to have you with us. And thank you, Delhi, for such a wonderful interactive session. And waiting to see you all next Saturday at 10 o'clock for another session. So take care, have a great weekend, and thank you so much, Seema.
Thank you.